I am in awe of my guest today because he is so accomplished and his contribution to our field, acupuncture and Chinese medicine, is mind blowing. We talked about Tui Na, which is Chinese massage, which I love. We talked about one of the best subjects so far in the Acupro Show, combining Western knowledge and TCM knowledge together to become the best, most trusted acupuncturist in your area. This is how we really, really connect with patients. And the knowledge of Western integrated with the TCM is the best way to go about it. So I love that Dr. Lixing Lao was born in China but came to the United States and loves to integrate the Western knowledge he has, because he has a PhD in physiology, you'll see, and his TCM knowledge together in order to teach future practitioners how to be the most successful one. You are going to love this conversation. Are you ready? Let's go. I am so excited for my guest today, Dr. Lixing Lao, who I am a little bit nervous because he has so many accomplishments. He has done so much in his career. I am very impressed, first of all, but I'm also very nervous and intimidated. So, welcome, Dr. Lao, to the Acupro Show.
Thank you so much, and thank you for your kind words. I'm not important. I just want to chat with you about acupuncture. Happy to be in the program. Thank you for inviting me.
Before we start, I want to say who Dr. Lao is because he has done so much that I want you guys to listen to this. And I'm going to read his little bio, and I really condensed it because there's so much more. But I'm going to give you the Cliff Notes. Dr. Lao is, first of all, a renowned expert in acupuncture and integrative medicine with over 40 years of clinical experience and research. So he's currently the president and a professor at the Virginia University of Integrated Medicine. He's also directs the acupuncture or the doctor of acupuncture and oriental medicine program. So he knows his stuff, and he's been on both sides of the spectrum because also he holds a PhD in physiology. So you can see the Western knowledge with the TCM knowledge mixed together. I always love that. He has published over 300 journal articles. He's contributed to books, and he has presented at over 360 conferences. Hello, anybody? Oh my gosh. Do you ever sleep, Dr. Lau?
Thank you.
That is amazing. He has a lot of awards. He loves to focus his practice on stress related disorders, internal medicine, but also very much pain related disorders. And one of my first questions with you today is your research has influenced acupuncture practices all over the world, including your work has led the FDA recognition of acupuncture as a medical device in 1996. So I really want to know, how did your research contribute to the FDA approving acupuncture as a medical device since 1996? Because that changes everything for all of us practitioners. So tell me, how did that happen?
So in 1994, actually, after NIH created the Office of Alternative Medicine, this office tried to do something with acupuncture, so they tried to have the hearing workshop with FDA. So FDA have panel to listen to the presentation from researcher on acupuncture. Gathering the expert, I was one of them to present the data. So I remember I presented data. They have categorized different kind of the aspect of acupuncture. So I presented two issues. One is safety of acupuncture. Any reported excellent or any adverse effect. And the other topic I present was the material of needles. What the composition material, how can be inserted safely or not, and is fragile or all this information. I present two lectures in this FDA conference. Then after the conference, after the workshop, FDA take about 2 years almost, and eventually come up with the decision in 1996 to reclassify acupuncture from investigational device to medical device. Since then, acupuncture become the mainstream device, can be used in any hospitals by doctors and acupuncturists.
That's amazing because we have our audience from all over the world. The FDA is the people that are going to decide what is part of the medical system, what drugs is going to be part of the medical system, and what devices like acupuncture. So I love that you started with safety because that's the primary concern, right? First of all, thank you for doing that.
Sure.
You made a huge difference in our medicine in acupuncture and Chinese medicine. So I love that. You were born in China. When did you come to the United States?
I came to United States in 1986 to join the PhD program
Okay.
at the University of Maryland on my PhD in physiology.
When you came to the United States, you already had your Chinese medicine and acupuncture knowledge. You went to school in Shanghai.
Yes, I went to the school called Shanghai University of Chinese Medicine. I was majoring in acupuncture, Tui Na, and the herbal medicine.
I love that you did Tui Na as well, because that's something that not every school teaches. Having said that, what I love is that you have your background and your knowledge coming from China and going to school in China. Then you come to the US and then you do a Western medicine PhD in physiology. So now you got two combined, which is the integrative part of your knowledge. Now you are the president of the school, the Virginia University of Integrated Medicine. Can you tell me about how do you teach integrative medicine at that school exactly? How does that work for students when they come in? What do they learn? What knowledge do they get from the Western side and Eastern side?
Yes, I'd be happy to do this. But actually, let me go back since you mentioned about my training and my background. When I learned acupuncture in the school in Shanghai for 5 years, a very extensive training, I knew that acupuncture works very well for all different conditions, particularly for pain. But then that time, I often wonder why and what's the mechanism of action behind. So after graduation, I was the teaching faculty in the first couple of years before I moved to United States. Mainly, I teach one course called Research Acupuncture. Reason I came to United States, want to learn physiology, then want to use the knowledge of physiology to explain how acupuncture work in body. That's the reason I came here to learn. I'm very lucky that I learned a lot from physiology point of view and able to combine this knowledge together to understand how acupuncture work in the human body. Lots of very rich knowledge there. However, there's some information that we don't know in ancient time because of the limitation of science and also limitation of the society, because in ancient China, we're not allowed to open the body to look inside organs because they're preserved. You cannot really easily open. So this limit our knowledge. But then also, of course, they all developed the new knowledge, which you have to figure out without open the body, figure out what's happening inside. Is another method. But now the modern science, modern technology allow lots of knowledge be exposed. Now we know how body composition, how body inside look like, and physiologically how moving, how fast the cardiovascular system working. So as modern society, as acupuncturists that live in the modern society, we need to understand the modern science. We cannot live in the past. We have to carry the inherited the past knowledge, but combined with new knowledge, enhance our knowledge and enhance the clinical skill. In our curriculum, we have two sets of courses. One is Western medicine course, one TCM courses. Then in the early stage, like the first year, the student come here and then we have about 30% of Western and 70% of Chinese medicine. I think good ratio. That they know at least some of degree of the by how body work, how body function. So then this accumulated knowledge until the later years, like second year, third year, we have course called acupuncture treatment. One is called acupuncture for orthopedic disorder, and also course called Tui Na treatment and Tui Na method techniques. Then a course called acupuncture treatment for internal disease. like you have headache or after stroke, internal disease. The student to prepare well with both knowledge in TCM as well as Western medicine. So these courses bridge these two together. So they understand how to look at disease, how to treat the disease, how to approach a condition. In my teaching style, we teach the acupuncture headache, just for example. First, we taught the TCM point of view. We have like a wind, cold, attack your body. And also we talk about the differentiation approach, like yummy headache, soyan headache, chewing headache, different all TCM. We also understand the blocked energy in the meridians cause the pain, stagnation of the shi. So we took all this, and based on symptoms, we make differentiation that people have the different combination, excess condition, deficiency condition. We're familiar with this. This purely classic and TCM. Then after this, we ask a student to have the kind of group discussion. There's lots of information in the website now. We should use them. Find a reliable website. I very often use the Cleveland Clinic and the Mayo's Clinic. And these are very reliable. And also some of Johns Hopkins University and Harvard Medical School. If you type the keywords headache, you can see the definition of a headache in Western medical point of view, and also see the risk factor, what cause and what's prevention, what you sometimes call smoke may cause headache, or stress may be cause headache, or diet. So these are all in the website. So our students, they understand Western medicine setting, how they communicate with the patient. So as the practitioners in modern society, we have to know too, and we have to communicate with our patient. When our patient come in with headache, we should ask them to quit smoke, don't drink much alcohol. So all this is from this website, which is not just Western medicine, it's evidence-based, based on their research in the modern society. So give students lots of tools to communicate with the student patients. And patients will really appreciate it because they think you are very knowledgeable. Okay, so this is the core integrative medicine. We do that. So I will ask a student in the classroom, do you know acupuncture works? Everybody said, yes, works, right? But do you have evidence? How can you show evidence it works scientifically? Then ask people how to this. And what useful, I tell them, if you work with a physician in Western medical setting, integrative medicine, they have Western medicine practitioners and TCM or acupuncturists, you need to communicate each other. So you can provide evidence to these Western medical doctors. They may not have time to read all the research paper on acupuncture, but you can help send a paper to them. Or when they mention some research paper, you understand. So then this conventional medical doctor or chiropractor, they think you're knowledgeable. They refer more patients to you. Okay. The other examples are used how to deal with insurance company. Okay. I had a graduate. She had a problem with the insurance company. She did not charge the patient because the patient has medical insurance. She claimed insurance. But after insurance reject the treatment, they said there's no evidence your client can treat neck pain. I go to online website, search the literature, and I find them 4 to 5 research papers. She sent all the information to the insurance company, and 1 week later, she called me and said she received a check from the insurance company. So lots of useful information to understand the current status of the evidence. I try to train our students not only know the Chinese medicine, but also know modern science evidence, research evidence.
I really appreciate you sharing this because I went to TCM school. I did a 5-year program in Vancouver, Canada, and that was before the internet existed.
Yes.
So it was really difficult to access any research, of course, or research paper because, we didn't have the internet. It was a long time ago. And I agree with you that as students or potential practitioners, we go to school, we are excited about learning TCM. That's why we go to school, right? We want to learn everything about TCM. And we're not really interested that much about the Western side. And I think everybody is when they go in. And I love that you put that integration because you're right. We are going to practice in the Western world. So we need to understand the Western medicine that we are practiced side by side with. And like you said, when patients come in and they say, I have, let's say, Sjogren's disease or Hashimoto, whatever disorders they have, it's important that we understand what it is in the physiological part of the body. And then we can apply TCM and look at the pattern of diagnosis. Of course, that's our strength, and treating the person as a whole. But understanding the disorder in a physiological way, but also understanding to communicate with patients. I love that you share research to share with other medical practitioners around us will help elevate our practice, and they will trust us because we have the research to basically support what we're doing, which I love that you share that. But what's interesting is when we have the both side knowledge, plus the research, plus the ability to communicate properly with our patients when they come and see us. I really appreciate you talking about the headaches, because when someone comes up with cluster headaches, like you said, or migraine, or whatever the headache is, it's important to understand what happened vascularly in the body, and then we could still apply TCM. Knowing TCM is our favorite thing, but it's important to have both. I have a lot of students listening and new practitioners listening. And one of the things that everyone struggles, because they don't all go to your school, unfortunately, but the thing that a lot of people struggle with is when patient asks them, well, how does acupuncture work exactly? They don't know what to say, right? They feel stuck because they're like, I can't say chi and meridian because people didn't learn this. So how do I explain it? I would love for you to say to the people listening, how do you explain how acupuncture works in a way that the Western society understands how it works?
So far, most of the research has successfully revealed how acupuncture work is in pain. And basically, there's lots of paper published, but in summary, very brief, they're all different levels. Acupuncture work in the peripheral level, in the near site. When you put a needle, large intestine 4, for example, there's something work there. And also to send a signal to the spinal cord. In the spinal cord, something happens there. React to the acupuncture treatment. Then all the supraspinal cord, which is brain area, also have lots of process. We find out by the research papers. In brief, for example, in the periphery, we can see when needle inserted into, you can see sometimes patient's skin is red. So dilation blood vessel, some reaction to this. So then also people find out their peripheral endorphins. Before we think endorphin only central nervous system, actually peripheral by lymphocytes. They can carry the chemical called endorphins in the local area that block the pain sensation. So patient feel less pain. But also peripherally, they can help the tissue recovery, tissue pairing. Okay. So very often the TCM not only treat the distally, we also treat locally. The low back pain or put needle in low back area. So the tissue after stimulation, they can start to recover, to repair by themselves. The peripheral level also like cytokine levels, pro-inflammation and anti-inflammation. So there's lots of research. And the spinal cord level is also one early stage we call gate control theory, block the pain, transmitting to the brain so patient don't feel much pain. They play different roles in pain research, in pain transmission. Then also we find that certain nuclei in the brain, particularly responsible for pain, okay, they respond for pain. Also they respond for the information. So for example, the signal sent to the hypothalamus. Hypothalamus, they're called nuclei called PVN, peripheral ventricular nuclei. These PVN can send a signal to the hormone system that can inform the pituitary to release the chemicals, which is go to circulation and to go to the adrenal in the kidney area. So adrenal will release the corticosteroids into the circulation and you suppress the inflammation. There's lots of information had been reported and summarized. So when you put needle, go in summary, put needle in any points, they send signal not only locally, they have trigger the repairing process, but send signal to spinal cord as well as the brain, and brain will send descending the signal to help blockage of the pain sensation. So these examples, but other conditions like people who want to get IVF, for example, different system, and some people have the other conditions, they have different mechanisms, but they're similar. All involve the needle sensation from peripheral to the central nervous system, and body have tendency to incorporate all these signals in the body to readjust your body's balance, yin and yang balance. So make your body speed up the recovery.
Are you ready to unlock the remarkable potential of a microsystem that is so effective for pain disorders you cannot bypass it? This is what Scalp Acupuncture course taught by my friend and colleague Dr. Sonia Tan is all about. This is at your own pace, and it focuses on treating pain and tightness, including all the types of musculoskeletal pain and injury, chronic and acute, as well as burning pain, tingling, and numbness. This course contains what you need to know to start practicing scalp acupuncture immediately upon completion. Now, this course utilizes the balance method from Dr. Tan, which makes it such a very effective method. Listen to what people who invested in the scalp acupuncture course have said. I want to thank Dr. Sonia for doing an amazing job. By attending your course, I have learned the right technique to treat patients when it comes to balance method for acupuncture scalp. I have started to treat patients using the method and have received great feedbacks already. It has helped my patients' body discomfort feel better. It is very easy method to perform on patients. I really did enjoy learning about the system and would be interested in learning other systems. Best teacher I've ever had. Generous in her teaching and friendly, very enthusiastic, clear and articulate, splendid, interesting, sharing knowledge in a fluid way, very passionate teacher, animated. Sonia is alive. I love that. Definitely not a boring course, I can tell you that. You'll receive continuing education hours and a certificate after you pass a multiple choice quiz. You have access to the course forever, so you can watch it over and over at your own time because it's pre-recorded. You also have a 7-day money-back guarantee because I stand behind my product, and I always make sure that the teachers that I bring on my platform are the quality of teachers that I so vet for you to benefit from. Don't miss out on the opportunity to revolutionize your practice using this very simple yet very effective method for pain disorders. Go to my website, acuproacademy.com, and click the TCM course tab on the menu bar, or check out the link in the show notes below and invest in the scalp acupuncture course today. You won't regret it. That's what's important, to be able to understand and explain it to patient in a way that they can relate, right? And so that's why in my practice, I've been practicing since 2003, so we're 2025, so 22 years now. When people ask how it works, or can you help me, I never say you have kidney yin deficiency or liver qi stagnation, or because they didn't go to school, they don't know, right? I always go exactly what you said, the cause and effect. You know, if someone has a lot of acid reflux and acid regurgitation and heartburn, and I figure out that the stress is causing all this, I'm not going to say you have liver qi stagnation, over controlling stomach, creating stomach heat. I'm not going to say that, but I'm going to say, you know, all the stress is causing a lot of acidity in your stomach. And then, of course, the acidity rises up and you have all these issues. So we need to bring the stress down because that's the cause. So this could also go down, right? And then people understand that. So the cause and effects always works. And then explaining exactly that. When you insert a needle, what happened? What is the mechanism between the inserting the needle and the nerval reaction and the nerve that basically sends signals to the brain to self-regulate. That's why I always say acupuncture doesn't cure disease. It just helps your body do the work, right? It's helping the body. So patients understand that and they love that. So thank you for sharing this. One other question I had for you, because you said you taught the Tui Na class. So for people that are listening, if you don't know what Tui Na is Chinese massage. So it is a big subject. And in most Chinese medicine school, sometimes we get a big class, sometimes we get a small class, and some schools don't teach it at all. I love Tui Na. I would love for you to share Is there any evidence base or research on Tui Na and its effectiveness? Because I feel like it's such a good tool and it's underutilized specifically for pain, since you do a lot of pain disorders.
Some school may not teach is because very few people really train the Tui Na. Even in China, not everybody knows how to do Tui Na because very small group, they learn Tui Na. Several reasons. One is the technique is difficult, not easy. You need a good teacher and lots of time to practice. Because Tui Na not widely used, because most of research they made on the massage. But some paper published for the massage for the low back pain in pregnant women because they cannot get needle for safety reasons. Also some pediatric massage for the children, right? Another challenging issue is that unlike acupuncture, we now have control group called placebo control. But between that, very difficult to make placebo control. So this is another reason it was difficult. However, in China, I know there are lots of research papers on Tui Na. Okay. But unfortunately, probably in Chinese language, when we not widely translate into English language, there's lots of research published in Tui Na particular techniques in China.
I love Tui Na, specifically you were saying for children, because children are a bit more scared of needles and it's a little bit tougher for them. But when you have parents and you can teach parents to do Tui Na on their baby or their young child, I found that the children react, or really the effect of Tui Na is so fast because children are very young, so they heal very fast, right? When you were saying it's really hard, it is so hard. I remember when my Tui Na teacher was teaching us different technique, and one of them was the vibration technique, where, you do on a point, the vibration push, and then we had to do this and vibrate. And he was like, if you can keep it for at least 1 minute, and we're like, minutes, not long, and try to vibrate this fast for 1 minute. And then he goes, try to go 2 minutes and 3 minutes. I'm like, I can't even do 1 minute. It's so hard. So Tui Na takes a lot of practice and years of practice. You're absolutely right. So not everybody obviously is going to love it because it takes a lot of practice, but it's such a beautiful modality. And I know there's shiatsu, there's other Asian way that are the same kind of massage technique that comes from acupressure and Tui Na itself. Do you use Tui Na in your practice when it comes to pain disorders? Because I know you really love to treat pain in general. So do you use Tui Na in conjunction with acupuncture? Do you use sometimes just Tui Na by itself? Do you combine? What do you do?
Yes and no. Okay. So you can say almost exclusively every patient I give acupuncture, I also give Tui Na. However, it's not extensive. For example, the patient stay in the treatment room for about 20, 25 minutes. The needling, when we withdraw needle, then some people will feel soreness in the needle side. I do some Tui Na about 5 minutes, I mean, even 2 minutes. Very quickly, patient feel very relaxed, very good after treatment. For the children, some children don't like the needle. So you use Tui Na, they're more acceptable. They like it. But for certain diseases, I use more Tui Na, more exclusively. For example, frozen shoulder. Frozen shoulder joint stiffness. You only needling only can decrease pain, but cannot increase the range of motion. So you need to passively to work on the shoulder to gradually open the shoulder joint, but you cannot just force them to very painful. You have to use the skills gradually
Wow.
open the joint and split the adhesive tissue together.
That's so cool that you talked about frozen shoulder, because my focus in my practice has been a lot of women's health. So over the years, I do a lot of fertility, pregnancy, menopause. And in menopause, there are a lot of women that get frozen shoulder. It's a big menopause symptoms out of a lot of women. And so every time I've had menopausal women coming with frozen shoulder, I always do Tui Na because it makes such a faster difference. And like you said, it doesn't have to be like 30 minutes. I do acupuncture, but then after that, I'll do some Tui Na, and people love it. They absolutely love it because you're right. It increased the range of motion, and the idea is to try to break the tissue, the adhesive tissue. So thank you for sharing this. I have a question for you because you have done so much for our profession, specifically out in the West, which I really appreciate because we need people like you to help out our profession. And what advice would you give new practitioners or future acupuncturists in order for them to excel in their career and be really really successful in their career? What is your best advice for them?
Okay, so in my opinion, so if you want to be successful, number one is you have to knowledge. You have to demonstrate you are very knowledgeable. So the patient come to your clinic, that you have confidence. Everybody have same experience. When you go to Western medical doctor, same thing. You want to see confident doctor. They tell you 1, 2, 3, what you should do, what you should not do. Trust come from the confidence. But where does confidence come from? Is because your skill. If you're knowledgeable, your confidence. If you don't know everything, wait a second, let me check the point location in my textbook before I put needle in. If you do this, nobody will come back to you again, right? So you have to have knowledge. You have to memorize lots of things in the brain so you can use easily. So then also knowledge including the conventional medicine. As I mentioned earlier, we teach students to search the information about the Western medicine website, but I be sure we don't teach them how to treat a patient using Western medicine. You have to understand how Western medicine treat a patient. So if some patient have lung cancer and you know about stage, you tell the patient, oh, I know stage, what chemo you're using now, you show your knowledge, even though you're not oncologist. But when the patient talk about their treatment, you understand, you fully understand. You create the confidence and create the trust between patient and you. All the patients like to see a knowledgeable practitioners, right? So it's very common. Not only knowledge or skill. We need to practice our needle technique again and again. Always, if we hurt the patient won't come back again.
Oh,
Okay,
I'm
so
so
this,
glad you said that. Sorry, I would
yeah.
interrupt you. I'm so glad you said that because so many people say, oh, no pain, no gain, whatever in English. But I'm like, no, I want my patient that is so stressed to get in a parasympathetic state and not go, I'm in so much pain, I can't even relax. How are they going to heal if they're not relaxed? So thank you for saying that. Continue. Sorry.
I remember in Hong Kong, I served as director of the School of Chinese Medicine in Hong Kong 6 years. Lots of patients from the Hong Kong local area. And one question I always ask if a chronic pain said, have you treated by acupuncturist? Yes, I treated 10 times, very painful, but I still have pain. So I said, why expect me to be better? Okay. Very often I have 1 treatment, 2 treatments, patient come back always patient the treatment no pain, but I feel much better after 1 treatment. I've got many cases like this. Then I start to study why. Then I figured out from the physiological point of view, the scientific point of view, why.
Thank you for sharing this because I don't like pain at all. So when I receive a treatment of acupuncture, I just want to relax. So I assume my patients want that too. And like you said, when your patients fall asleep or just get up and they're so relaxed, like they just meditated for 20, 30 minutes, 40 minutes, whatever, they look so relaxed. This is effective because their body was finally, especially nowadays, everybody's so stressed, everybody's running around, they're so busy, and there's no time to kind of decompress. So we don't want to stress them more, right? And you're right, because I've had patients sometimes that come for pain. And I had a patient that came to see me years ago, and he had a car accident, and the car accident had happened 4 years prior. And he had had a lot of treatment, including chiropractic, physiotherapy, massage therapy, injection, a lot of corticosteroid injection, a lot of medication because he's in pain constantly for 4 years, which is, I can't even imagine. He can't sleep. He's in so much pain. So he stopped working. It's very difficult, right? And he comes and sees me. He had never had acupuncture before. So I said, so what are you doing right now? And he goes, oh, I go to chiropractic twice a week. I go to physiotherapy. I go to massage therapy. And I was like, I can't put more needle in this person's back because the pain was back pain and neck pain. And I said to him, you know what? I'm not going to touch your back. I'm not going to do anything on your back. We're going to lay on your back, face up, and I'm just going to try to bring the anxiety down because it is anxiety when you're in pain all the time and you feel hopeless, like you're never going to get better. And so I did a treatment to really bring him in a parasympathetic state and calm him and just relax. I did not touch the pain because everybody else is doing the pain. I don't need to add more. So for him to heal, he needs to calm down and be relaxed. So I did that. And when I took the needles out, he started crying. And I was like, are you okay? Are you okay? And he said, It's the first time in 4 years that I feel relaxed. And I was like, oh my God. And so he said every time he came in, he's like, don't touch my back. Let's continue to do this because it's making me feel so much better. I really love that you said no pain, much better. So that's the patient can calm down and heal, right? So thank you for sharing that. I appreciate it. And I love that you say skills is important. Practice, 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 and continue to learn, right? Continuing education is so important because that's how we grow. When I was in school, I did not learn about IVF, right? We didn't learn about IVF in my school. So when I came out and I had, I wanted to focus on women's health, and I had a lot of people coming and I said, oh, I'm doing IVF. And I remember thinking, well, I know it stands for in vitro fertilization, but what exactly happened physiologically when they do IVF? What is it they're doing? So I had to go do all the continuing education, all the research to understand, because you're right, patients trust you now when you know exactly what drugs they're going to do, what's a retrieval, what's happening when there's, hyperstimulation of the ovaries. Like, you understand everything and then they trust you better. Thank you for sharing that as well. So happy you came in today. There's so much knowledge in your brain. I want to open your brain, go inside and learn all the knowledge you have, and I want to take it out. But so
Thank you.
I just wanted to ask you for anything else you'd like to share before I let you go back to work. And I really appreciate you again, Dr. Lau, for being here today.
Only one thing, maybe two things I want to add is you asked me about a 1994 FDA workshop in 1996 with approval. Actually, one more event, 1997, called National Institute of Health Consensus Conferences. They usually have this kind of conference for every different disorders or different device, different medications. They usually set up the panel, in this case, 1997, mainly from different universities, all Western medical doctors. They're not statisticians, the 13 people a panel. So then listen to a group of the acupuncture researchers, including me at that time. So I present my study. At that time, I finished my dental pain study for postoperative dental pain. So I present my data, then they review all the published paper on the research paper on acupuncture in different areas. They said very clear evidence to show acupuncture for the postoperative dental pain, which is my study, and postoperative pain, nausea, vomiting. So this area they confirm. The other area, this statement I would say dramatically opened the door for, particularly after 1996 approval of needle device and medical device. And this statement, this consensus conference, the review, the safety, effectiveness, and mechanism of action, and of course everything, they give very positive statement. Let's move the acupuncture practice forward in the United States.
You are a TCM rock star. Woohoo! You are a rock star. Thank you so much. And you had a second point you wanted to share. Go for it.
Very quick that I want to mention, we recently have some school closed and also decrease. But actually, if you look at the entire condition, acupuncture compared to 20 years ago is much advanced. For example, many insurance company covers right now. The means of demand increase. All the large hospitals, particularly for the cancer center, they hire acupuncturists to treat their patient. So this is good movement because what? Because the evidence base, because lots of evidence recently published. So this is support usage. And a couple of years ago, the Medicare also covered acupuncture, even though only started with low back pain, but it's the first step. You're going to have more and more. So the long history, I think, particularly for the pain, which is opioid crisis in this country, acupuncture really is non-pharmacological approach can help ease the pain and help our patients. I feel very confident acupuncture going to very bright future.
Yay! I love it. I love your positivity because I agree. I travel in a lot of places in the world and give seminars or teaching. And because of the platform I have on social media, I get to connect with a lot of people all over the world. And even though, like you said, some schools in the United States in the last few years have closed down, the world is rising up with acupuncture. Many new schools are opening all over the world, everywhere. People love evidence-based acupuncture. I have a friend of mine, I don't know if you know him, his name is Sandro Graca, and he has started a whole department in acupuncture research in the university in the UK, and they have a whole research department on acupuncture now. It is fantastic. So it is really showing up the world that it is more evidence-based every day, more research every day. Not only that, but in Canada, for example, in Vancouver, the auto insurance for the cars, if you have a car accident, they cover 12 sessions of acupuncture, no question asked. You can get 12 acupuncture session after an accident. It's paid for 100%. A lot of places now cover acupuncture, like you said. In a lot of places in the world, we see them in the hospital, we see them in many places in the world. So I am like you, I'm very positive about the future of acupuncture. I think it's growing and growing because it's needed. We need it. Everybody needs it. So thank you so much, Dr. Lao, for coming on the show. I so appreciate your time, your effort, all the contribution you have made to our medicine. You are a rock star.
Thank you so much. One point I want to add, one challenge we also have, but we should realize, because the usefulness of the acupuncture, lots of evidence, acupuncture really works for many different conditions. Many other professions also want to use acupuncture. Like a medical doctor, PT now use acupuncture as dry needles. So this is a challenge for the community of acupuncture, non-physician acupuncturists maybe. But how we can overcome the challenge, that's my suggestion. We have armed ourselves, update our knowledge. Tell you the reason why. The Western medical doctor, they use acupuncture. They have knowledge on Western medicine. They know the mechanism of actions. They learn this their area, but we don't. So if we only talk about qi and yin and yang without knowing, we'll be gradually pushed aside, not in the mainstream. So we need to arm ourselves, know all this information, then we're able to communicate with all the conventional medical doctor, and we're able to practice in the hospital, different area. Then we are part of this team, acupuncture team in the United States for patients, not an alien from another place. We should have knowledge. Some students say, oh, I only want to know Qi and TCM. I don't want to learn any modern science. But the reality is that sooner or later you will be excluded. Okay, you will be affecting your practice. So we want to have knowledge in the modern science and modern technology, whatever we learn from nowadays.
I agree. The more knowledge you have, the better you'll be successful as a practitioner and the better for the profession. So I agree. Absolutely. So thank you for sharing that as well.
Thank you for having me in the interview. Very nice talking to you. Thank you.
My pleasure. Thank you so much for spending your time with me today. I truly hope you benefited from this episode, and I would love for you to share it with a friend that may benefit from it as well. Follow the show, leave a review, and if you want more, go to my website, acuproacademy.com. I have tons of resources there with treatment protocols, case studies, free courses, and so much more. And connect with me on all social media at Acupro Academy. I'm on YouTube, Instagram, Facebook, X, Pinterest, and LinkedIn and TikTok. And no matter what, keep rocking it using TCM. Please listen to the disclaimer, because the Acupro Show podcast and material shared through Acupro Academy, which is a subdivision of Natural Health Sense Incorporated, are designed solely for educational and entertainment purposes. The utilization of information from this podcast or any associated material is at the user's discretion and risk. This content is not meant to replace the guidance of an acupuncturist, Chinese medicine doctor, medical doctor, physician, or any qualified professional, nor is it a substitute for proper diagnosis or treatment. Users are strongly advised not to ignore or postpone seeking medical advice for any existing medical condition with their healthcare professional regarding any health concerns.